Hello, everybody, and welcome to another episode of Dr. Drew Explains It All. Today, I'm actually going to be talking about a therapy that I just had done. I know a lot of people have been asking me about it, and I finally had it done today, and I wanted to pretty much update everybody on how it went and let you know what the process is like. Um, I'm sure a lot of you by now have heard about stem cell therapy. If you've seen my previous episodes on glue ear, it is now they say one of the solutions to glue ear is to get stem cell therapy. So I've literally tried everything else with my autoimmune deficiency, so I figured I would try stem cell therapy. A lot goes into stem cell therapy that you really don't think of. First, you have to do your homework, so that's lesson one. Because there are a lot of different treatments for stem cell therapy. The two main treatments, number one, is they would take a needle, such as something like this, a specialized needle, and they would extract the stem cells from your stomach. The second would be where they go into the bone marrow, and there's a whole process in what that entails as well. So I did option number two. I know I've had family members do option number one. That's a different process than the one that I'm going to talk about today, which is the bone marrow portion of the stem cell treatment that I decided to pursue. First off, when you go to and look around for stem cell treatments, make sure to shop around. It's no different than buying a car or buying furniture or buying anything else. There's a lot of different treatments. They do it both first internationally and they do it nationally. And you have to make sure that you're not going to get ripped off. I literally talked to about 5 doctors in 3 different states. I'm in New Jersey, so I talked to doctors from New Jersey, New York, and Pennsylvania. And I had quotes for the same type of therapy anywhere between $5,000 to $12,000 per treatment. And I had only planned to go once. So, and they give you all different reasons. Because there's a couple ways to do option number two, which is the treatment through the bone marrow. The first way that some doctors recommend is through a baby's umbilical cord, an unborn baby that is FDA approved at, I don't know how the whole process works. And they say the stem cell from the umbilical cord, there's a lot of stem cells because they were unborn and the DNA isn't written in them yet. Therefore, when they are injected into you, your stem cells can have fun with them and do what they want to do, and that will make it a very effective treatment for whatever you need it for. People use stem cell treatments for a lot of different reasons. Some do it for their joints, for their hips, for osteoporosis, for arthritis. Mine's an autoimmune deficiency. So there's a lot of different ways that you can use stem cells, but they do recommend, some doctors recommend the the unborn umbilical cord. The other way to do it is using your own stem cells. And obviously, that's the treatment that I chose to go with, because the theory being, if you use a baby's umbilical cord, it may reject some of those stem cells. Some of them may not be good, and your body may reject it, therefore causing unknown side effects that you didn't want in the beginning. Your own stem cells your body's not going to reject your own stem cells. So they use your own stem cells. I guess the theory between them is, do you get more stem cells from yourself, or would you get it more from the umbilical cord option? All I can tell you is, from what I was told from my surgery today, I got plenty. We'll get into that in a minute. So once you shop around, you find the price that you want. I chose one. I was able to get it for about $5,000. I know internationally they are cheaper. I know Mexico does them for probably $4,000. It's different ways that they do it. But I chose to go somewhere near me especially during this coronavirus COVID time. It wasn't smart to do it anywhere else for the time being, because I wanted to be nearby, and if something went wrong, I wanted to make sure I could go there for help. So, thank the Lord, everything seems to be fine so far. So, that was the first thing. I shopped around, I got the price that I wanted, and then I scheduled an appointment. In my case, I scheduled it with Regen America, which is, I'm pretty sure they're a chain. You can go to regenusa.com. They have several different locations. The one I happened to go to was in Philadelphia, and everybody was very nice. I walked in. They gave you a form to fill out, and on how you were feeling this day, because the only reason why they would not treat you is if you had a temperature, especially during the COVID-19 crisis. They don't want to treat anybody who is sick. An infection could make the procedure risky. So I temped out at 98.1. I was just fine. I think the normal temperature is like 98.6. So I was right within the range that they needed to be at. You fill out the form, and then they bring you into a room where you kind of relax for a couple minutes while they're getting the operation room set up for you. So I said, okay, that's fine with me. And then they ask you to take your coat off, and then you meet the doctors, the various practitioners, the doctors, the assistants, the nurses. And when I say it's a surgery, it is, but it isn't. Because you go in there, there's a bed like you would like when you go to a normal practitioner's office, a doctor's office, and just your normal bed with a pillow, and they ask you to lie on your stomach. But even before they do that, the doctor actually lifted up my shirt and found the perfect place that he wanted to inject the actual needle for the actual surgery. And so he would feel around, and in this case it's the back hip. You could pick any hip you really want. He chose to pick my left hip, and he was kind of massaging it around there for a while, and they finally found the perfect spot. And they say the thinner you are, the more in shape you are, the easier for this procedure for them to do it. So I have very little fat by my back hip, so it was very easy for him to find the perfect spot. And so he found the perfect spot, he marked it, and when I went in the room, they were able to lift up my shirt, and they found the spot. And basically what they do is they first load you up with lidocaine. It's a form of Novocaine, so everything is pretty much numb, so you really don't feel much. That's the whole point of it, is to dull it down so when the next step comes in, you don't really feel too much. So I didn't really feel too much. I felt when they were poking me with lidocaine, I have a reaction to Novocaine, so they used lidocaine. And basically it was pretty numbed up after about a couple of minutes. And then the next thing I knew, in comes the special tool, and you feel a pressure as they're turning it. It's almost like a screwdriver. They turn it into you because they have to get into the bone for the bone marrow to get the stem cells out of the bone marrow. So you feel this like kind of turning like you would a screwdriver. It really doesn't hurt too much. So I was that part was okay, and then that was in you. And then comes the fun part. Now, they tell you when you do this type of procedure, you really don't feel much. When you go into the bone marrow, you feel it. Because at that point, they take this specialized needle that separates the platelets, the stem cells, and the plasma, and everything else like that. And they literally, it dives into the tool. The tool is like this. It goes into the tool, and then they suck out the stem cells. and they fill it up, and then they go to another one, and they suck out the next one. And when they're sucking that sucker out, oh boy, you feel it. I don't care how much lidocaine you have. It almost feels like somebody's like really hitting on your funny bone hard, and it's got that like sucking motion, and you really have a reaction to it. I mean, it's not the worst feeling in the world. I'd say from a 1 to 10, it was about some of them got to 6 to 7. In my case, they drew mine out five of these so 5 times. They say the normal amount that they do is anywhere between 1 and 2 for people. They wanted to make sure I got enough for my money, most bang for my buck, and they liked the stem cells that they were pulling out because they said I had good blood and good bone marrow. So they kept going. Basically, they can get all they can get while they were in there, as long as I could take it. So the pain was pretty intense as they were sucking it out, and it lasted for about like 10 to 15 seconds each time they did it, and then you felt relief again. And after they were done, they put these on the side, and basically they unscrewed the tool, and they covered you up. And what they like to do is this is the part where I start to disagree. They like to really overload you with tape and gauze. I mean, I'm going to show you what the blood sample looks like from how big it is, okay? So you can see right there, it really isn't that big. That's about the size of hole that the blood made from the surgery. So it was only more like a pen point. And for all this tape, I mean, it is really uncomfortable when they put it on you, because when you rip it off, boy, do you feel it. And so what I actually did was I bought, after the surgery on my way home, I went to Target and I bought the Band-Aid water block tough strips, which looks like this. It's the same thing. The thing is, why they put this on you, they try to seal it because they don't want you taking this off for 72 hours, because they don't want you laying in water, they don't want you laying in a bath, a hot tub, anything like that, because they're worried about an infection. These are waterproof. So I went to Target, like I said, I bought a box of these. They cost like $3.49, and they're waterproof, and they're a lot smaller. Just take a look at the difference, and they're a lot more comfortable, because after they do it and the lidocaine wears off, oh, you feel it. And the problem is you can't do anything about it. You really can't take Advil, you can't take Tylenol. They say you can take a leave, because especially if you have a headache or something like that, because again, it's a blood thinner, and they don't want to screw with that for the next 3 days, because they had to shoot, I guess, some of the stuff that was shot into me with the stem cells. They don't want to screw around with that, because they're not sure the bleeding would stop. So that was one part I didn't enjoy, and I didn't think it was necessary, so I overruled them on that and got something more comfortable. I would recommend, if you have this procedure done, you do the same as well. So the next part, so it's all separated now into this like centrifuge needle thing, okay? And then what they do is they bring you back into the other room, and they lay you down on another bed, and they bring, in my case, you can, like I said, you can have this procedure done 2 different ways. You can either have it shot into a joint, if that was your main problem. Mine is an autoimmune deficiency, so I need it through an IV. So my issue is a little different than other people that get this type of procedure done. It's usually for joints, where they'll shoot it back into the joint or a certain area. That's not the case with me. Mine had to go back into the bloodstream. So they had an IV there waiting for me with this saline, with the IV fluid and everything like that. And they took my right arm and put the IV in. And again, of course, after that whole procedure was done, I was left with this. We'll get back to that in a second. So they put the IV in, and then you just see the IV like on top of you, and they take the needle, and the IV has 2 chutes for the bag, and they take, because I had 5 of them, so they took them one at a time, and they shot it right up into the bag, which mixes your stem cells with the IV fluid that is going into your body. And they do that till it gets down to a certain level, and then they come in and they shoot the next needle of stem cells in there until all 5 are used, which took about 45 to 50 minutes. And once that was done, because all this depends on what they told me, if they find a good vein. When they stick the IV, and they have to obviously put it through your vein so it gets into your body. And luckily for me, I had a good vein. They were able to do it with no problem. They said the older people, sometimes if they don't have good veins, they have to try this butterfly technique, and it can get pretty tricky. They have to get a certain doctor in there. Fortunately for me, that wasn't the case. Everything went smoothly, and it took about 45, 50 minutes for it to finally empty. And then they put this wonderful thing on you with the gauze and the tape and stuff like that, because they don't want you to bleed, and they want you to keep it on for a day. Again, same thing, got a smaller version of the waterproof Band-Aid for this, and I will keep this on till tomorrow, a lot more comfortable. I do think Regen USA should just go grab a couple boxes of these suckers, because their patients would enjoy this a lot more. It's a lot more comfortable in the same time. So basically, I do have a little pain in my arm, not much. Obviously, when you get IV, that's pretty normal. I do have pretty decent pain from a 1 to 10. I'd say between a 4 and a 5 right now. It's supposed to wear off tomorrow from what they told me. In terms of the actual procedure, they said the bone marrow actually pretty much replenishes itself very quickly. So they want me to take it easy for the next week, not play any sports or anything else like that, not doing anything too stressful. Not that I'm going anywhere anyway, in New Jersey lockdown with the COVID virus currently, so I picked a good time to do this type of surgery, because it did need to be done. And basically what they do is after that they check in with you about a week later to make sure everything went okay. And I know basically you're saying, I've heard from some people that after you do a stem cell treatment, there's certain things you can eat, there's certain things you can't eat for a month or two. I know in my sister's case, when she had it done the other way through the stomach, they didn't want her eating chicken because it had certain hormones that wouldn't counteract with the stem cells that were injected to her correctly. Since mine went through the bloodstream and I did it through bone marrow, they said there's really nothing I can't eat. My diet wouldn't change at all. That isn't the problem. They just don't want me, again, taking Advil, Tylenol, or aspirin. They said a leave should be okay, but if there's any pain reasons for the blood thinning type of reasons. So, yeah, stem cells are definitely used for all of these things. They are used for autoimmune, they're used for joints. And what the theory is behind them is the cells regenerate themselves because cells replace each other every 7 years, okay? And with a copy of each other. And usually the copy is slightly worse than the copy you had before. That's why you age. And they say in a lot of these cases with stem cells, it reverses that process. So you're actually Benjamin Buttoning yourself to a certain degree in terms of what you want done. In my case, I'm looking to focus on my eyes and my ears and my sinuses. But it also does things like gives you hair growth for people who are balding, that I have heard as well. And it does regenerate your cells, so your cells are getting younger while you're getting older. It counterbalances yourself. You actually look a lot better as you age in terms of the skin and the complexion and wrinkles and stuff like that as well. So it does give you some added benefits. How long before things start to work? Well, that's the $64,000 question. They pretty much say, the doctor who treated me today pretty much told me that I would start feeling the effects actually today in terms of feeling more energetic. He's right, I do. I do actually feel more energy than I did before. He said, but you really start seeing it in the weeks and the months ahead. So it's not something that happens overnight, but it takes time for your cells to, take these stem cells and do what they're going to do with it. And in my case, he told me I got billions of stem cells in from the 5 injections that I had today. And he said from a 1 to 10, it was a 10, it was a total success. And like I said, they usually take 1 or 2 of these. I got 5, which is almost like 3 treatments in one. So I'm very happy that he was able to get as much as he possibly could. Because if you're going to spend anywhere between 5 and 12 grand, you might as well get your money's worth. So again, guys, that's my... I will hopefully do an episode on my glue ear part 4 on how the stem cell therapy ended up working. I also did it because with my ears, they only work about 60% when I have a head cold or I get an infection or I get in something like that. This should improve it to about 85-90%. And that is one of the main reasons why I said health is wealth and I'm trying this. Because it is the wave of the future, and I will update you on how everything went in terms of my progress and my percentage of success with this entire treatment. So thanks everybody for joining me today. Everybody stay healthy and safe, and I'll see you next time.